I'm Randy Rasch, and I'm Dean of the College of Nursing at Michigan State University. Today, Dr. Patrick Crane is our guest. He is an assistant professor in the College of Nursing at Michigan State University, as well as a practicing nurse practitioner in the state. He holds a Doctor of Nursing practice from Wayne State University and is also a Spartan alum. Welcome to the show, Dr. Crane.
Thank you for having me.
Today, our topic is the NCLEX, the National Council Licensure Examination, or NCLEX, is a test that every nurse must take in order to be a licensed registered nurse following graduation. Today we're going to talk with Dr. Crane about some of the ways to prepare and get ready for the test. So let's just dive in. What should test takers expect going into the NCLEX?
It's a pretty loaded question, actually, but
we can break it down.
Yeah.
How long should they expect it to take?
And again, that depends. So the exam is sort of an interesting format in the sense that it's a competency-based exam. So I think most of our listeners out there are probably used to exams where you take a set number of questions, you're expecting a certain percentage, and you either pass or fail. The NCLEX is a little bit differently, is scored a little bit differently. So essentially what the exam will do is you'll sit down and you will know going in that you will take a minimum of 75 questions and a maximum of 265 questions. What the computer is trying to do throughout that process and is determine if you're competent to be an entry-level nurse, if you're safe to enter practice. And so what it will do is it will keep testing an individual until it has a 95% confidence that you are safe to practice. And so if you answer the questions very well, it's going to throw harder questions at you, what they deem to be harder questions. The difficulty will increase, and if you continue to answer well, the exam is going to shut off earlier. So it may shut off at 75 questions. However, if you are sort of moving up and down above and below that competency line, it's going to keep giving you questions of varying difficulty until it can make the determination that, yes, you have passed and yes, you are competent.
So that's an important point because I've had students sitting for the exam and almost all of them, it shuts down at about 75 or 80. On occasion, one goes this entire amount and they're sure that they have failed.
Right. So I can speak to a couple stories. I often have contact with our alums shortly after they take their NCLEX exam. And every now and then you do hear, I took 265. Oh my gosh, what does that mean? And it doesn't necessarily mean you failed. In fact, I would say it's rare that it means you failed. The other thing that the exam does is if you take all 265 questions, and it still hasn't made that 95% determination, it will take a chunk of your last questions you took in order to determine if you passed or failed. So it's sort of an interesting process and a little bit of a moving target. But don't get discouraged if you took 265. If you feel good about it, which I don't know who feels good about walking out of the NCLEX exam. I know I didn't. But generally speaking, that's not a determination if you passed or failed. Just as taking 75 questions isn't a determination if you passed or failed. You either did very, very well or very, very poorly.
Yeah. So let's talk about the type of questions that folks will probably encounter when they sit for the NCLEX.
Sure. So it used to be that the questions were fairly straightforward, multiple choice questions, no true faults, multiple choice questions, where they would ask for things like, what is the nurse's next best thing to do? Or what is the nurse's priority? There'd be questions covering a multitude of subject matter, everything from pharmacology to basic care and comfort to medical surgical nursing to psychiatric nursing. And that hasn't changed as far as the type of content that students will be asked about. What has changed is now we are seeing alternate format questions coming in. So there may be photographs that students will have to identify. There may be multiple correct answers. You'll have to forgive me. I don't know if these have been implemented yet, but I know they were looking at some matching type questions, but I'm not sure if those have rolled out yet.
What's the format that they should expect?
So the format is going to be varied. It's not going to be simply multiple choice anymore. I can tell you the experience that you'll have is you'll go to a testing center. You will be put through a rigorous process of providing a palm print, photo ID. It's a very, very secure exam, probably more secure than getting on an airplane anymore. They take the exam very, very seriously. Obviously, we're dealing with nurses being determined to be competent to enter practice, so we want to protect our public and protect the profession of nursing. You'll sit down at a computer, and you will be presented one question at a time. You'll have to answer that question as it's presented. You can't skip questions, go back to questions, which you may be used to. And then at some point, the moment of truth comes where that screen just goes blank. It doesn't say, thanks for participating. It doesn't say, congratulations, you passed. It doesn't say, congratulations, you failed. It will just turn off and say, please exit the room. And then generally you'll have to wait a couple days before you hear back from your score. Now, when I took the exam, they took about a week to score it, and I took it the day before the 4th of July, so I had a holiday in there. My anxiety was not great over the course of the holiday, and now generally get the question or the results back a little bit quicker.
So I took them when you took it in person with hundreds of people sitting at a table. What is the most challenging part or parts of the exam, do you think?
I think students generally struggle with a few major overarching points about the exam. Number one is the unknown. We here at Michigan State University and the College of Nursing, we try to prep our students the best we can by using software that simulates NCLEX style questions. They take those exams several times throughout their curriculum. But anytime you're going into a high stakes exam, and this is the highest stakes exam many of these students have ever sat for, the fear of the unknown, not knowing what it's going to look like, not knowing the emotional end of trying to parse through that exam, sitting still. It's difficult to sit for 265 questions. There's no doubt about it, especially when you're used to taking 75 to 100 item exams. The other challenges I feel are being able to prioritize, because often intentionally designed into the NCLEX exam are several answers that could be correct, but it's knowing what the nurse, underline, bold, would do and what they would do next, what they would prioritize. So that becomes challenging when you see multiple right answers and you have to pick the one that is appropriate to your role, to your licensure, to your education. That becomes very, very challenging. And often those are the types of questions that students struggle with. The other challenge is that many of these questions are layered, so you'll have to have multiple pieces of knowledge in order to use clinical judgment to come at that answer.
So what are the best ways to prepare for the exam?
I think you need to prepare for it using a few different methodologies. What I tell my students to do is to create a study plan. So these students are graduating. They're probably going to take the exam within about a month to 2 months following graduation. So I tell them to actually structure a calendar, and I tell them to be realistic. You're not going to be able to study for more than 2 hours a day. That's unrealistic. You can't study for 8 hours straight and have it be any kind of meaningful study. I tell them that they should be taking about 100 questions a day. We have some evidence that supports about 100 items a day of practice testing. So luckily now with smartphones, there's plenty of apps out there to help you do that. So I tell them anytime you're sitting in a waiting room, getting your tires rotated, et cetera, pull out your phone, do 20 questions. The other thing is when they study, they need to be sure that they don't just know the answer, but they know why they're answering that way. So any materials the students purchase, anything they're looking at, they need to have rationale, because it's not enough to know the answer. Because of how the NCLEX is structured and because of how they're educated and expected to practice, they have to know why. And if you know why, you can answer any question thrown at you. And that's what I tell them.
So I think you touched on this, but let's go ahead and specifically ask, where can students go to get practice questions or tests?
Sure. Our graduates have access to a library of test questions that's actually offered at the MSU library. That software is called Board Vitals, and that's a library of, I think, around 3,500 NCLEX style questions. There's several private companies out there that offer study guides with example questions. Kaplan is one. ATI is another one. I'm trying to think of some of the others out there. The National Council of State Boards of Nursing, who actually write the exam.
ATI or somebody too, I think.
Yep, ATI. That's what we use here at the college to prep them. And so they've purchased those already. But for graduates of other colleges of nursing, there's all sorts of resources out there. There's print books that you can get. Again, just make sure they have rationale in them. Plenty of apps, plenty of websites. There's entire structured programs for preparing for the NCLEX offered by several companies.
So what happens if you don't pass the first time?
So if you don't pass the first time, it's stressful because you do pay for the exam. It's a high-stakes exam. It may delay employment, but you can retest. Often what students will do if they don't pass the first time, they'll call either somebody in the university and say, hey, I need some help studying for this. We give them the same pointers we just talked about. And then they have to, unfortunately, pay to sit for the exam again, and it may delay their employment. But generally speaking, I think students who don't pass the first time really are suffering from that world of the unknown as far as what the exam is going to look like. They may not have taken their study incredibly seriously and then realized, oh, this is a whole new level of preparation, and they usually do quite well on the second time.
Yeah, I think in my experience, most people pass the second time, and probably the most stress, apart from the student taking the exam, is the program, because we look at the percentage of people that pass, because that's a reflection on the program, and if the scores are low, there are repercussions for the program. Fortunately, here at Michigan State University, I think our track record has been like 99.9 to 100% pass. So anyone graduating the program has that. When you know that, it gives you a certain amount of confidence that your predecessors have been really successful.
Right, and I think that means that we're teaching them in a way that they can be successful. It's always a challenge, academically speaking, to prepare nurses and not prepare them to take an exam.
Right.
So that's the balance that we have to walk, is to make sure that they're thinking like nurses, and then they can apply that thinking to NCLEX style questions.
So what should you do if you don't pass the first time?
The first thing I would do is I would contact somebody at your College of Nursing, because they can help get you in touch with resources. They can help guide you to further help. They may be able to find a peer to help you study. I would certainly take a look at your practice testing. What areas did you struggle with? Focus on those. What areas are doing well? You may not have to focus as much on that. But again, get a calendar together, do a very planned system of studying. And if you didn't pay for one of those products, one of those prep products before, usually at that point I'll tell a student it's not a bad idea to try something else. Try one of these preparatory courses so that your studying is more formally guided.
So what is one thing any NCLEX test taker should absolutely do or know before going in to sit for the exam?
I think the items we just talked about are incredibly important. I think they need to know how to study. I also think they need to know that no matter how much studying you do, you're never going to feel 100% ready. I've yet to talk to a graduate who has walked out of that exam and thought, oh yeah, piece of cake. There's always some degree of doubt there. So do take it seriously. Do give it time to study, to prep, but also know that it's another exam. It's a high-stakes exam, but it's just another test. It's the last hoop they have to jump through to enter into practice.